Disturbing surge in heart attack cases has put Karnataka's health department on high alert. Data from two key health programs, STEMI and the Puneeth Rajkumar Hridayajyoti Yojane, has exposed a cardiac crisis sweeping across the state. In just over 2 years, more than 7 lakh people reported pain in the chest in 75 taluks under the STEMI project. Of these, over 3.9 lakhs had abnormal ECG readings. Most shockingly, 6,574 were confirmed heart attacks, while timely intervention saved over 5,500 lives. 1,050 people died of cardiac arrest alone. The Hridayajyoti Yojane, named after actor Puneeth Rajkumar, only reinforces the crisis, with officials now calling for urgent upgrades in cardiac care, public awareness and emergency response system. The health department is now pushing for early screening and faster ambulance to hospital pipelines as heart diseases silently becomes Karnataka's next big killer. I asked during the Hassan heart attacks, and I'm going to ask here again, what do they mean by early screening? Who are these people that they are targeting? Dr. Ashit Sridhar, lead interventional cardiologist, Mangala Heart Center, and Dr. Mukesh Goyal, senior consultant cardiology, Apollo Hospitals. Both of them have joined. Thank you so much, doctors, for joining us on this. Let me first go to Dr. Ashit Sridhar. Dr. Ashit Sridhar, these are horrifying numbers, isn't it? I mean, last time I think you were on my show, you said that we have numbers and many states may not have the numbers. But if you take this in isolation itself, Dr. Sridhar, 6,500 heart attacks, that's a large number.
Yeah. Yeah, so we have been telling that, we have been seeing an increased heart attacks from the time last 4-5 years. We have seen a dramatic increase in heart attacks. We have seen the age of presentation of these patients being much more younger. That has been happening for quite some time and steadily increasing. There is no doubt about it, but it happened that, there was a media focus on the recent deaths in Hassan, and then suddenly now the focus has shifted in this area, which is actually very right. That, now we are focusing the fact that there is a significant increase of heart attack in India, in South India, in Karnataka, throughout, everywhere we are seeing it, and more younger patients are presented us with heart attacks. There is no doubt about it. We do have a data now. This data was never focused on. This data was never kind of put into a public domain. So now we have the data and we know what to do now. Once we have the data, the next thing what we have to do is prioritize this cardiac health, focus on the prevention, focus on the early diagnosis of heart attacks, and focus on the primary angioplasties as early as possible, so that the staggering death rates what we have seen can be reduced dramatically.
Sure, it's staggering, and please watch the screens, ladies and gentlemen. 6,574 diagnosed with heart disease, 1,050 deaths from cardiac arrest. These are so many deaths that have been reported, and Dr. Sridhar is very right that they are very aware, they've taken cognizance. Now 7.22 lakh reported chest pain from March 23 to June 25. Dr. Goyal, what is the answer? They say, well, let's have early screenings, the ambulance to kind of hospital, that should be also kind of, strengthened a lot, because time is of the essence here. But I'll ask you once again, this kind of statistic, and if it has been reported, like Dr. Sridhar says, by the media, yes, it's been reported, it's very important, because there is definitely a lifestyle change shift which has happened, Dr. Goyal. There are no two ways about it. There is something which has happened, and I'm asking you that what is the method to the madness, whether it's me as a journalist who doesn't get time at all, and lots of my colleagues work 7 days a week for 10 hours. That's the statistic, if you want to know. Or if it is someone who's riding an auto rickshaw or who's a gig worker. I mean, where do people have the time, unless the state has a very strict, in a lot of countries there is very strict kind of health surveillance. We lack that as a nation, Dr. Goyal.
So, Sudha, you have rightly pointed out that we don't have really screening methods and aptitude and attitude of the government and public as far as heart disease is concerned. So till now, public health in India means surveillance for tuberculosis, malaria, dengue, like these kind of things, or maybe pneumonia in children. But as a cardiology community, we have been we have known for last 20-30 years that India is basically, there is a epidemic of heart disease which is developing. The Apollo group as a whole had some data, and it has pointed out in last 3-4 years repeatedly that we are sitting at a time bomb. And now the Karnataka government, this project, Hridayajyoti project, they have done a wonderful job to bring in attention the real problem. And you can actually consider this data representing whole of India. And 10% of people, adult people in India in their lifetime, they will suffer from heart disease sometime in their life. And 1% and 10% of that, they will die because of the heart disease. So that is 1% of the population dying with heart disease. So it's a big problem, and we have to bring it into as a public health domain, and put public money and the policies
I agree,
to
Dr. Goyal,
screen and
but
prevent it.
but whatever has been given as preventive, you have to learn CPR, ban on smoking in public places, and recruitment of cardiologists at taluk level. I am sorry, this is all kind of very far-fetched. Dr. Sridhar, for screening to happen, and I expect like it's like my dental checkup twice a year. I do go. America, everyone goes, but we've made it a point. That's because I have the money to go to, and I do these checkups. Mostly I don't even do it, let me be honest. I'm asking you, where is the government's plan to make it a discipline, Dr. Sridhar? All this smoking in public, ban, don't eat oil, ban, don't, all this is cosmetic. We have a major emergency on our hands. But I don't see, I was wondering if the health minister will also come out and speak about something which is doable. Why is there no plan, Dr. Sridhar? I mean, I am an auto rickshaw driver, I get acidity, I go to the doctor next door who may be a quack, he will give me some medicines, 2 days I will be fine, without knowing that maybe it's an indication of a cardiac disease that I may have. Dr. Sridhar.
Yeah, so my senior colleague rightly pointed out that in India, we did have programs, whether it's a vaccination program or a malaria program, tuberculosis prevention programs and control programs, where it was significantly successful. To that time, now since we have realized that there is a pandemic throughout the world, there is actually a pandemic where the heart attack related deaths is the #1 killer worldwide. It's not just in Karnataka, not just in Hassan. Throughout India, the heart attacks or the heart related ailments are the #1 killers. Second thing is that we have a lot of younger age group, people in their first decade, second decade, succumbing to sudden cardiac deaths, and these are all preventable deaths. A very lot of these are preventable deaths. To that extent, yes, there has to be a systemic approach. For example, in Western countries, all the school children or school-going kids are screened before they get into competitive sports. They are never allowed to a competitive athletic sports unless they have been screened in the school days itself. And nowadays, this is not, previously when we were studying MBBS, we used to say that the diabetes and hypertension are basically the ailments of urban population or ailments of, with excess cities. Now that is gone. Now I work in a tier 2, tier 3 setup, and most of my patients are rural folks.
Oh.
Heart attack doesn't differentiate between poor and rich. It doesn't differentiate between urban and rural. It happens for everybody. So, and everybody, all of us, has to screen ourselves.
Yeah.
It doesn't know whether.
I'm so happy that, you've said one thing which is the truth, and it's not a rich man's disease anymore. Everyone presents, even in rural areas, because you see a lot of rural patients. But Dr. Goyal and Dr. Sridhar, the Karnataka government needs to bring out a very, very carefully calibrated systemic approach for screening. I'm sorry, Dr. Goyal, but your hospital may be very expensive for someone who drives an auto rickshaw, unless you have special programs for the poor. Where is the plan?